Welcome. I'm Ann Klee. I'm the president of the Connecticut Psychological Association, and I'm here today with several colleagues from both CPA and colleagues from Delaware and Rhode Island. And we're here to talk to you about what's going on with small state psychological associations, lessons learned about growing our membership and setting priorities. And I'm going to begin with talking about some challenges that we're facing here in Connecticut. So our numbers are on the decline. In the 1990s, we had approximately 700 members, and at the time there were about 1,400 licensed psychologists in our state. So we experienced about a 50% membership rate. Every year since then, it's been going down about 10 to 15% a year. And at this point, we have about 200 members, and yet there are over 2,000 licensed psychologists in our state. And that trend of more and more psychologists, there are more and more psychologists now throughout the country than ever before. Yet in Connecticut, we only have about a 10% membership rate. And the average age of our members is 59. And so we know one reason we have fall off as many are retiring. And yet we know our early career psychologists join, but they only stay on average for about 1 to 2 years. So this picture is not looking good for us. And the question becomes why? And I spoke with a bunch of our past presidents, and there's a lot of speculation, of course. Some said it dates back to when we moved to managed care in the 1990s, and that members lost faith in what state psychological associations could do. We really couldn't increase revenue for psychologists. But if we look to a few different things that happened in our state increased licensing fees, and now they are up to $570 for a psychologist. There were other things going on in the world, 9/11, the 2008 recession, the idea that we're competing for memberships with other organizations. Many psychologists belong to divisions, they belong to societies, and that maybe they're just not joining their state associations because they're joining elsewhere. As I said before, we have an aging membership, and our dues are really high. They're at $325 a year for full members. They just might be just too expensive, especially with the high licensing fees. So what does this mean for us? Our financial losses we've seen this across the board. We've lost office space. We have lost a full-time executive director. We had to move to an executive management company. And then more recently, we lost the position of our director of professional affairs. And those are extreme losses for a very small state association that has very small staffing. And we have a bare bones budget. So right now we have a part-time executive management company. We have basically a part-time lobbyist, although she works for us full-time. She does so much for us. We have very limited travel to conferences like the State Leadership Conference, very limited budget for social events. And even at our board meetings, when we have them in person, board members contribute to dinners. So we're not spending a lot of money. But really what this comes down to is we are at extreme risk for losing our voice. Our lobbyists and our CPA, we are extremely involved with what goes on in our state capitol in Hartford. We are tracking over 100 bills each year. We are fighting for really important issues, and especially when Washington, D.C. is gridlocked, states have so much to offer because we are doing really innovative, cutting-edge work here on the state level. We fought for mental health parity. We have bills for SIPACT and prescriptive authority. We are testifying all the time. Last year on helmet motor cycle safety legislation, we have been able to oppose bills on conversion therapy. we are there protecting both our psychology licenses and the public. And it's really important that small state associations like ours be able to have this voice. And without our lobbyists, there's not much we can do. So at this point, I'm going to turn the mic to some of my colleagues to talk about what we've been doing here in Connecticut to address our membership decline.
Thanks, Anne. My name is Megan Butler, and I'm currently the secretary and co-chair of the membership committee for the Connecticut Psychological Association. My section will be covering some of the foundational fixes that we've made to address the membership decline. So with membership numbers on a downward trajectory and a budget based solely on membership fees, CPA knew the organization was not sustainable. So through attending the Practice Leadership Conference in DC, we were able to gain valuable resources, APA's marketing data, and advice from other SPTAs. So one of our goals for membership included first, engaging and retaining our current members. We really wanted to stop the bleeding of this 10% loss each year. Next, we wanted to target our lapsed members because these people have already been identified as having value or interest in joining an organization, but maybe haven't renewed for various reasons. And then lastly, we would actively recruit new members, which would likely be a bigger project. So using some of the fundamental marketing concepts, we developed a couple of strategies. So we wanted to demonstrate our value, which includes knowing our audience, figuring out what that audience needs, and then providing services to meet those needs. And lastly, kind of broadcasting our ability to do so out to the state. So in regards to our demonstrating our value, CPA provides a decent amount of services, but were they meeting the needs of our psychologists? Our membership numbers suggest that maybe not, we're missing something. And do psychologists in the state even know about our benefits? And we think the answer was no. In regards to communication, CPA was not that accessible. Initially, our website was out of date with little capacity to develop additional member benefits. And our methods of communication were limited. We had social media accounts, but they weren't active. And our newsletter exists, but only in digital format due to funds. And lastly, if we're, in regards to meeting the needs of our psychologists in Connecticut, CPA didn't have accurate data about the psychologists in the state. We had limited ways to reach the psychologists and no data about their current needs. So while CT is a small state, we hypothesize that the distribution of psychologists varies greatly in terms of geographical location, with likely more psychologists closer to the New York region, and in terms of career stage, as Dr. Klee mentioned, the average age of membership is more in that senior career category. So we really needed data in order to plan relevant events, allocate our resources, and consider location and accessibility of our services. So Dr. Spellman and Dr. Geit developed the Priorities Survey for Connecticut psychologists, which was a very exciting success, and they'll talk about more in a moment. Developing the survey was a lengthy process, and the largest barrier was really how to reach psychologists in the state with limited contact information and a limited budget. So our survey was digital, and the links were sent via email to every email contact that we had in the state. And that was a list that was manually developed by board members and not inclusive of every psychologist in the state. The link was also posted to our website, and we developed a postcard mailing with the link and a QR code that was mailed to every physical mailing address of psychologists in the state. This was, of course, privately funded by donations from board members. Additional reminders were given at the convention and in other mailings where there was no additional cost. So while the survey was in process, CPA was simultaneously working on other initiatives. CPA's values defined by our member benefits, which you'll see listed there. And they're comparable to other small SBTAs. And most notably, like, we're very proud of our lobbyists, as Dr. Klee mentioned, and that is a benefit that's accessible outside of our membership. Non-members benefit from that as well. And even though we have a strong foundation of benefits, we were still able to broaden out our services. So we have regional representatives, and our CE and networking events increased in addition to our annual convention. And these events were discounted or free to members, and also a way to draw in revenue from non-members. A substantial initiative was the development of our webinar series. This was made free to members, and it was an attempt to modernize and increase accessibility to CPA, and again, to generate revenue from non-members. We were hoping that if non-members were paying full price at several events a year, they might consider joining and getting that benefit for free. We broadened our reach by developing a neuropsychology division, and yet our greatest weakness was still our communication efforts. So sadly, as one website viewer commented, is CPA even in existence anymore? Not so great, right? So in order to improve our communication, we knew our infrastructure needed work. So our goal was to make interfacing with CPA more closely aligned with modern consumer expectations. Our website needed to be functional with glitches removed, and payment functions needed to be seamless. So we needed those social media accounts to be active, and we were hoping to have consistent messaging across all platforms, website, and e-blasts. We wanted a listserv that was manageable for our all-volunteer board. Internally, a significant change made to our organization was the discontinuation of our DPA position, as Dr. Klee mentioned. The responsibilities for DPA were dispersed amongst the board, and then the budget was reallocated for marketing. And then the last sort of internal infrastructure change was really maximizing the capacity of our board. Really becoming a well-oiled machine. So recruiting for any and all open positions on the board, really clarifying roles and responsibilities, holding regularly scheduled committee meetings, and in between our in-person board meetings, holding brief but frequent contacts using digital communications. And this greatly helped to maintain our momentum, to keep kind of our volunteer board accountable and committed to following through on ideas. So in regards to the successes and barriers of our infrastructure changes, after a 2-year process, we have modernized our website to a platform that specializes in member-based organizations. This was a substantial investment for the organization, and challenging. Because of our small budget, there were limitations on the type of technology consultants to develop the site. We now have a very active listserv, which was outsourced through APA's listserv structure rather than directly tied to our website. Social media has been considered a priority, specifically because it's free and an easy method for frequent communication to our audience and to advertise events and accomplishments. The biggest barrier there is person power to maintain those social media accounts. So I would say in general, in regards to CPA's infrastructure, there's never a shortage of ideas, but there is a finite amount of volunteers to execute and limited financial resources to see it through. Where has all this gotten us? So in regards to our outcomes as they stand today, as the result of these initiatives, we have successfully collected data on Connecticut psychologists, which you'll hear in detail from Dr. Spellman. We've had modest improvements in retention rates. So in that first goal, we kind of have slowed the bleeding. But we've only had slight improvements with new licensed psychologists. And areas where we've seen success is that we've substantially increased our student member rates. And again, there's a common theme. The ongoing obstacles here is limitations with finances, materials, and manual resources. A sticking point, we know that membership fees are too high, and then a likely barrier but because of that shoestring budget, we're unable to lower the numbers. Additional obstacles that even with the technology improvements, tracking membership rates, and maintaining a database with contact information for our psychologists is still really cumbersome. And then lastly is our next steps. So we've been fortunate to be able to utilize a grant from APA to develop an early career leadership academy, which we're very excited about. Our student and diversity reps have created a leadership academy for students of color. And then we plan on using data from the Priorities Survey results to drive new membership strategies, such as expanded social justice platform and advocacy engagement. All right, I will go ahead and turn it over to Dr. Geit.
Thanks so much, Megan, and good morning. I'm Jessica Geit, and I serve as CPA's science representative. My background's as a pediatric psychologist, clinical research scientist, and consultant, so I was really excited about collaborating with Anne, Mark, and Megan on data-driven approaches to clarifying and advancing CPA's organizational priorities. In my section, I'm going to be very briefly focusing on the process of development of our priority survey before Dr. Spellman gives us all the details. So the process of creating the priority survey was a catalyst really for CPA to more clearly define its value. It wasn't created in a vacuum. It was an iterative process that evolved over months and was the result of multiple CPA board meeting discussions during 2018 and 2019. The initial organizing task was to create a brief membership survey that can help retain current members, re-engage lapsed members, and help to acquire new members. And the initial groundwork covered, which Megan talked a bit about, was engaging the CPA board in responding to questions and discussions focused on clarifying CPA's existing benefits and what's most valued about membership. And you can see those 6 points that we really distilled there. Focusing on questions around what do we really need to know to sustain the organization and to stay relevant. So after gathering some initial information from the CPA board, we established a work group to further refine the survey and prepare it for wider distribution. And I want to just say the encouragement and leadership of our amazing CPA president, Ann Klee, was critical to the success of our work group, maintaining regular communication and overcoming barriers to the process. The survey development process also helps CPA to do some organizational housekeeping. So for example, we created survey items and potential response options that generated additional questions about the existing CPA policies and procedures. The survey aimed to engage current and new members, also prompted us to focus more on our website, as Megan talked about, and we all kind of knew that was in need of some updating. And in hindsight, this led to multiple action items that required CPA board input to resolve before the survey could really be launched. So it was an illuminating process. We learned a lot about the organization and our resource challenges, and the process was at times painful. At times we kind of felt like we were continually plugging leaks that kept springing. But we recognized that we could only go so far with our existing resources and had to continually reprioritize the steps we could take to meet current and future organizational needs. Examples of some of the priority action items that emerged were things like streamlining the membership joining and renewal process. Again, many of these things Megan touched on, making sure we had clear membership categories and fees, broadening our social media use, and investing in the website again. And ultimately, this developmental process helped CPA to take stock of our resources and strategically plan where we wanted to go as an organization. And just in brief, the final survey was launched in September 2019, and we, as Megan mentioned, tried to capture all the psychologists in the state. That would be approximately 2,000. We, as she mentioned, distributed some emails, postcard mailings, and also in-person collection of data at our annual convention. We used an electronic survey platform that helped us to also manage the data. And it included all sorts of items with branching logic, so we could reduce the time each item or the survey would take for each of these different 4 categories of members that we were particularly interested in at different stages of their careers. And data collection wrapped up in January, so our results primarily reflect responses that were made before the COVID-19 pandemic. And without further ado, I'm going to turn over the floor to Dr. Spellman, who's going to tell you the results that we found. Thank you.
Thank you, Jessica. Thank you for joining us. Good morning, or whenever it is, wherever you are. I'm going to be highlighting findings from our survey. I hope this will be an ongoing dialogue and process where we can talk more about detailed finding and subgroup findings in the future. Our survey purposes were to increase and retain membership and to know where to prioritize our resources. We had a very good response, wide-ranging across different professional activities, which really helps with generalizing findings to the Connecticut psychologists. 84% white and 66% female reflects our profession. I want to mention the income range of respondents because it will be important to talk about future findings in context. The majority of our responders have an income between $75,000 and $150,000. Half are very active in CPA as indexed by attending our annual conference. I'm going to talk just about some of our key findings and the implications for what we might do about them. Most importantly, our legislative advocacy. Our lobbyist at the legislature and our testifying at the legislature is what's most highly valued among respondents, including early career psychologists. Knowing more about our legislative lobbying would motivate lapsed and non-members to join or rejoin. The implication is straightforward. Featuring legislative lobbying efforts and accomplishments is the single most important message for retention and growth. There were many dualities in the data. For example, findings show that we are seen and valued both as a professional agency and as a social justice advocate. Social justice advocacy is important for membership decisions for over half of our current membership. The implication is we must focus messaging on both classic professional agency issues, such as insurance reimbursement and social justice issues. Another duality we saw in the data was that while many of us care about social justice issues, half of our respondents want more leadership opportunities made available to them. These two findings merge into, we will maximize engagement with CPA if we create a wide range of social justice themed work groups, which offer leadership roles to those most committed to high priority issues. I'm going to go over those social justice issues at the end of this data review. Another duality was in commitment to membership. Half of our membership feels strongly committed and is highly likely to renew, but half only feel moderately engaged and are only moderately committed to renewing. The implication there is that we need to prioritize retention communications and look for leadership roles to increase engagement, which relates to what we just talked about social justice work group formation. Financially, half of our membership and prospective members feel significant financial stress, including moderate incomes and significant student loans. They would greatly appreciate financial membership incentives, but half of our membership is financially comfortable and would not. An implication to consider is offering sliding scale options to those who need and request them, but to ask for full fees and dues for those who would not. This data slide highlights the services that CPA offers as far as how highly valued they are by respondents. Over 70% of respondents highly value our lobbying at the Connecticut legislature. 68% value professional assistance, a similar number lobbying for better reimbursement, classic professional services. But advocacy is also highly valued, leadership and healthcare reform, our healthcare reform task force, advocacy for social justice, our ethnic diversity task force are all highly valued advocacy services in addition to our classic professional services. And you see the most highly valued financial thing we could do would be offering CE credits at a reduced rate. I mentioned earlier that there are many social justice themes that are valued, but it's not like one theme or two themes. So I don't want this to be about most highly valued theme. The point here is to see how many social justice issues are highly valued by at least 20% of our membership. The highest valued would be healthcare and mental health care disparities, followed by gun violence, educational disparities. Human trafficking includes both sex workers and domestic workers who are exploited. Immigration reform, again, remember this was fielded before the current protests and massive outpouring of concern about social justice. Gender violence, quality child care disparities, incarcerated people's reentry support, police reform, and tailoring health to mental health to LGBT populations are also important to subgroups of our membership. That's what I have time to cover today. I hope you'll join us for future conversations for more detailed findings and subgroup findings.
Hi, I'm Peter Oppenheimer. I'm the Director of Professional Affairs for the Rhode Island Psychological Association. Elizabeth Gibbons and I will give some brief perspective from our states of Rhode Island and Delaware. So RIPA recognizes that we are what APA used to call a very small state association. And that was a state association of under 200, but our membership has grown in the past 25 years from about 160 to now about 220. There are over 1,000 active licenses in Rhode Island now, but the actual number of functioning practitioners is about 250 to 300. We have always had a part-time executive director, and if our executive director happens to have an office space we can use, we make use of it. Most of our work is volunteer driven. Despite our growth, we continue to operate with a very small state mentality, and that is to get by with minimum infrastructure and costs in everything we do. A key for us is that we have worked to develop a culture that we are one community and that we are supportive of each other no matter where we work, and that we all have a common interest. So we endeavor to make RIPA essential for Rhode Island psychologists, and we want them to know that. Advocacy has been a major focus for us. We work with state government to address policy and legislative issues. We deal directly with the insurance companies. And over the years, a segment of our membership has really come to recognize and value that. We encourage our leaders to get involved with APA, and that has helped us make use of APA services and meet our member needs by knowing who's there and what APA can do. We put a lot of effort into communicating with members. We haven't always been able to sustain our efforts, particularly with social media. I respond to a lot of questions members have about licensing and insurance companies all the time. We have a really great CE committee who put on programs that are very popular with the membership. We are too small to have a convention. We've tried. So instead we have quarterly meet and greets around the state that have become popular social events. Our board members actively go out in the community to recruit. We have gone out to the universities and engaged students, done presentations there, and that has helped bring in members and teach them the value of membership. And finally, we never forget our budget is frugal. We need to do the essential things we do and keep it to that. So that's it, and let me pass it to Elizabeth.
Thank you, Peter. Delaware is similar to Rhode Island, Connecticut in that we are a small state geographically. However, we have even fewer licensed psychologists from which to recruit, both for membership and for leadership positions within the organization. We don't have an office, physical address. We're making use of surveys, and we've been slowly moving into the modern era. Our electronic membership records only date back to 2013. Here are some things that make us a little bit different from what you've heard already. We've actually been blessed with an increase in membership since 2013. Then we had 106 members. Now we have 255 members out of 559 psychologists licensed in the state. We've stayed committed to maintaining a part-time executive director and an administrative assistant. I've been very lucky in who we have in those positions. We've never had a director of professional affairs, so I'm not sure yet what we're missing, but I'm feeling sad. Our largest membership group is the early career psychologist. Defining that as APA does is less than 10% since their doctorate. 37% of our current respondents are early career psychologists. So when I look around our executive council, I know that the future of psychology in Delaware is in really good hands. Here's some things that we have done to be frugal, stay focused. We don't have a lobbyist, so we use an online service called Bill Tracker to help our state advocacy committee and any member actually who wants to keep up with what's going on in the legislation in Delaware. We've been very planful as to how we pick a PLC contingent. We're a small state, but we want to have a loud voice. So we make the president-elect go each year, and the executive director, and then we fund where APA does not fund the early career and the diversity. We've also been very blessed that some of our larger employers will pick up the other half of that. I think our biggest focus has probably been on the early career psychologist and how do we capture and engage them. The pipeline, as they say, starts in graduate school. Like Peter mentioned, we engage with the graduate school programs, try to get student members. We have student members on our board. We have very strong focus on early career psychologist, which is supported by something called an institutional membership. So agencies that have a number of postdocs can pay for all of their postdocs to have their membership with one check. And then if we can get those postdocs engaged in the early career committee with the supports we have for that group, they tend to stay and they tend to take on leadership positions, which is fabulous. One of the things that we've done to keep the momentum going with the committees is that there is a rolling calendar for the year indicating which committee is to make a report to EC each month. That report is also tied to the article that they have to submit for the bulletin. So that means that meetings are happening and we're going forward. And I wanted to add that our committees include those that are organized around professional practice issues, advocacy issues, and public service. So we have committees in all of those areas. A final advantage of our small group, which the other states might recognize as well, is our ability to pivot and respond in unique situations. For example, we were able to act quickly and successfully to get SIPAC through. We've been working on telehealth and insurance issues related to COVID-19. We had an emergency call to action for all the committee chairs focused on dismantling racism, which was quickly followed by a town hall, which all members were invited to participate. I look forward to sharing these and other ideas in future forums.
Well, thank you everybody for spending some time with us and listening. We are exploring ways to continue this discussion in coordination with Division 31, so look for an announcement from Division 31 about that. And appreciate your time and take care and good luck. Thank you.